Alistair Burns is my name. I'm the National Clinical Director for Dementia and Older People's Mental Health at NHS England. I'm really sorry I can't be with you today, but I've heard from Shubhi all the great things that you're doing, and to have 80 or so dementia fellows in one room talking about dementia from such a multi-professional background is a real treat, and I'm really sorry that I can't be there. What I'd like to do is just say a couple of words about where things are from my point of view nationally around dementia, but just before I do, I'd just like to pay tribute to all the huge influence that Shubhi has had over the years in dementia, co-writing the National Dementia Strategy, authoring the influential Call to Action report about the use of antipsychotics. So I'm really sorry I can't be there, but it's great that you have someone who's there who's leading you in the discussions. I think for me one of the key things is that the awareness of dementia has increased hugely over the last few years. There's been a lot of publicity, political interest, and interest from a whole host of people. And there are a number of ways in which that I think we've been able to capitalise on that for the benefit of people with dementia and their carers. For me, the experience of dementia is something that we really need to change, and in fact the tagline of the National Dementia Strategy in 2009 was living well with dementia. And I think when we're judged about all the activity and interest, it's when people with dementia and their carers can say that living well with dementia is a reality, is for me when we'll really be able to say that we have improved things. In terms of the diagnosis, we know that that has increased significantly over the last few years. When I started around 2010, it was about 42-43%, and it's gone up now to over 60%. I think that for me is important, because not only for individuals is the diagnosis important, but for me it opens up the prospect for post-diagnostic support and care planning. And for me that brings in something else, which is the key role of primary care. There are very good examples across the country where secondary care memory services are becoming much more linked into primary care, and that can be doing clinics in primary care, or in some places having colleagues in primary care taking a lead over the diagnosis of dementia and the initiation of treatment. And I sometimes use the analogy of diabetes. When I was young, diabetes was a condition that was diagnosed and treated in secondary care, and now much of work in diabetes is in primary care, and for me that's a key aspiration. Care planning, support for people with dementia and support for carers is key, and I think it's fair to say that over the next few months and year or two, that's something that we are really going to emphasise, to look at the importance of care planning. There are a number of other things involved. Changing the perception of dementia, I think, is key. We now have 1 million Dementia Friends, and in the latest Prime Minister's Challenge on Dementia, the aspiration is to have another 3 million Dementia Friends. And I've seen in a number of areas where that has really changed the perception of dementia. We have dementia-friendly individuals, and if you get a chance, dementiafriends.org.uk is the website where you can get plenty of information. We now have dementia-friendly communities, and we also have the prospect of dementia-friendly schools, which could potentially bring in a dementia-friendly generation. We're looking at prevention, and we know that a certain number of new diagnoses can be prevented by individual risk reduction, largely looking at vascular risk factors, and with Public Health England, there's a big push on that. So that's just one or two of the things that are around at the moment. Again, I'm really sorry that I can't be with you today. It sounds like a great programme that you've had, and all credit to Shubhi and his colleagues for organising a great day. If there are any thoughts or anything come out of the meeting that you want to write to me about, alistair.burns@nhs.net, and I'd be really pleased to hear from you. Hope you have a great day, and thank you for listening.